The CDC director is warning of what she calls a rapid and troubling rise in COVID hospitalizations in parts of the country with low vaccination rates. The highly contagious Delta variant now makes up more than 50% of new COVID-19 cases in the U.S., as high as 80% in some areas, and it appears to affect young people worse than previous strains. So what could this all mean for the start of the school year? Education Secretary Miguel Cardona is here with more on what to expect this fall. Secretary Cardona, thanks so much for being here.
Happy to be with you.
So I want to start with what almost every parent is wondering right now. What really is going to happen with schools this fall? Kids under 12 still are not eligible to be vaccinated. A lot of parents are expecting to go back to the office in September. So can they count on schools being open 5 days a week?
I expect all schools across the country to give students full-time schooling 5 days a week in the fall. Our students have been waiting long enough for that. I'm glad to see that the data got better as the year progressed, but it's time to bring our students back full time. And keep in mind, we were able to do it successfully in places that used mitigation strategies, so there's no reason that I feel we can't do that in the fall.
And what about in areas where vaccination rates are low and COVID cases are rising again? Do you think that will be the case there as well?
You know, we have to focus on, if we really want our schools reopened, we have to make sure we're getting vaccinated in areas where they're not getting vaccinated. It works. We have months of data to show that the transmission rates are low and people can get about business as usual before the pandemic when they're vaccinated. So part of the campaign to reopen schools is making sure that vaccination is available and that people get the shots in the arm. It works.
So you're expecting, I just want to be clear, you're saying that we can expect for school to be open 5 days a week throughout the country?
You know, as you know, I don't have local jurisdiction over school boards and state policies, but it's my expectation. I want to be very clear. Students learn best in the classroom. I think they've suffered enough through this pandemic, and it's on us now to make sure we're doing what we need to do to get them safely in the classrooms daily where they belong.
So, Secretary, if that's your expectation, will the Department of Education track COVID outbreaks in schools, and will we see updated guidance on mask wearing?
We're definitely working closely with CDC, and we have 3 handbooks out there already. We're going to continue to update those. We're working daily. We have phone calls with different states on a daily basis to make sure that not only do we expect them to be reopened, but that they're using their American Rescue Plan funds to make sure that they're putting in place those mitigation strategies to make sure schools are safe for reopening, not only in the fall, but now in the summer, where we know many students are benefiting from summer learning experiences.
And speaking of those funds, we know states got $10 billion from the Biden administration to launch testing programs this fall. What can we expect when it comes to COVID testing students and staff? And do you know the percentage of schools that will actually be testing kids regularly?
You know, that's a good point. I visited schools and districts as far back as March, and I saw testing sites on location, in gymnasiums, in local recreation centers for students and staff. This is part of the reopening strategy, ensuring that we're giving not only testing availability, but also vaccination availability at our schools. I've seen it in Washington, D.C., I've seen it in Boston, and I know across the country that's the expectation. We want to help districts set those places up, and I think that's part of the strategy that they need to be thinking about. Yes, we are going to be collecting data, and we're going to be working closely with those districts where there's an increase in COVID-19. But we do expect this summer that they set up those systems to get those schools open in the fall.
And the Chicago Teachers Union is proposing an 80% baseline for age-eligible students to be vaccinated by October, along with provisions for unvaccinated teachers to be able to continue to work from home. So what's your take on that? Should schools make vaccines a requirement for teachers or students or both?
You know, the goal is to get students in the classroom every day, and we have to continue to work to make that the goal. Our students have waited long enough to be in full time, so it's on us to get it done. Whether local boards and states have a role in the contracts, and I won't get involved in that, but what I will say is that the resources are there, the science is there. We need to do our part to make sure the students go in person every day in the fall.
Secretary, I know you're well aware children are resilient, but they've been hit hard this past year. There are disparities, inequities, as we see more white, wealthy students returning to classrooms compared to children of color from low-income families. How are you addressing that, and how concerned are you about learning loss?
the sense of urgency that I bring to the table is because I know gaps were exacerbated in this past year. And some students had more access to in-person learning and to high-quality instruction than others. So we have to do everything in our power to get good summer learning opportunities for our students and make sure that in the fall, students have full-time in-person learning. But they're also going to have mental health support. They're going to have experiences for social and emotional learning development. We're not only going to assess what was lost, but we're going to really aim higher to make sure they have opportunities for enrichment as well. The American Rescue Plan and the whole goal to build back better is really making sure that we come out of this not where we were before the pandemic, but better. The resources are there, the innovation, the ideas that I'm hearing across the country are inspiring, and we're going to continue to do that because our students have been waiting and they deserve the best.
All right, Secretary Cardona, we appreciate your time today. Thank you.
Happy to be with you.
And for more on this, let's go to ABC News contributor and medical director at Medical Home Network, Dr. Jay Bhatt. Dr. Bhatt, thank you for being here. I want to ask you, as a medical doctor, how can schools reopen safely with this new variant at play? How much does this change things, or does everything just continue the way it was, you think?
Well, thank you so much for having me. I think that we're making progress, but let me be clear, COVID-19 is not over, right? Given the unvaccinated pockets, the Delta variant, people returning back to the new normal, there's enough ingredients to drive another surge in an area with growing cases. So I think that what we can do is, one, we have data internationally suggests that school reopenings are safe in communities with low transmission rates. We got to push to get transmission rates in communities down. And we can draw on our learning from last fall for this fall with the added benefit of knowing more about the virus, having vaccines for those 12 and older. And I think we'll be back in school, but can only remain safely in school if they're using safety measures to prevent spread. So wearing masks indoors, keeping kids spaced apart, staggered schedules, grouping the same students and teachers together throughout the school day where appropriate, making adjustments in extracurriculars and co-curriculars to mitigate spread. That may mean you might have to cancel certain events or practices, and having testing and contact tracing in place, which I agree with some of the comments made by Secretary Cardona. And we need to make sure masks are being used indoors where appropriate, doing what we can to make sure all eligible students are vaccinated. And if we could go to school last fall with masks, I think we can certainly do it again this fall if needed. So I think that it's positive, but there certainly is a window for the virus to continue to spread if we don't do the things right.
So how worried do you think parents and teachers need to be at this point?
I think that parents and teachers should feel confident in the progress we made, in the vaccinations that are available, and the science that we know about the virus. That being said, they should also be cautious about areas in which spread is high, where cases are high, and should be taking all precautions that we know work into consideration, including masking, distancing where appropriate, and most importantly, vaccination if eligible. So, I think that it's really important that kids are back in school. It's important to their development, important to their well-being. And I think that it's important for families and communities. And so we need to do everything we can to ensure that happens safely.
Meanwhile, I know Japan has declared a state of emergency just ahead of the Tokyo Olympics. The games are still set to go on, but without fans in the stands there in Tokyo. Do you think that's the right move?
I think one of the fears I have in a country where the vast majority of people have yet to be vaccinated, crowds at the Olympics could drive cases up. And so that's certainly the safest way to hold Olympics would be without fans. Allowing fans presents a risk, not just at the venues, but also on transportation, restaurants, and other public spaces. So I think that the Olympics could apply lessons from the NBA last summer, where an intentional approach with use of public health measures such as masking, distancing, and cohorting, along with adequate testing and contact tracing, help mitigate infection and spread. So it certainly can be done safely, but got to have mitigations in place and consistent, and as many people vaccinated as possible.
All right, Dr. Jay Bhatt, we appreciate your time today. Thank you.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.